All right, so introduction. We talk about technology and its improved safety, quality, and access to care, right? And we want to focus on quality, safety, and efficiency. It's woven into the nursing practice, administration, education, and research. So, nursing informatics definition, just to be repetitive, is the integration of nursing science, computer and information science, and cognitive science. It helps us manage communication and expand the data, information, knowledge, and wisdom of nursing. We use technology, research, and professional experience to manage nursing data. So what can we do with nursing informatics? We need skills in computer literacy, information, project management, information management, communication, leadership, making judgments based on data, trends, change management, and innovation. So those in informatics work in administration, leadership, management, analysis, compliance, integrity, consultation, risk management, coordination, facilitation, development, education, professional development, policy, advocacy, research. Did I say enough? So quality and safety, we look at outcomes management. We synthesize knowledge, we improve performance, we maintain data integrity and reliability. We aggregate data, so we collect data and we store it properly. Identify benchmarks. What are certain outcomes and where do we want to reach? Develop performance measures and assess workflow. So what are some benefits? Safety. Computer technology can place safety barriers with high-risk processes, okay? Think about medication administration. Places that use the scanning administration for medication went down to 0% med errors. 0%. You cannot fight 0% med errors, okay? That's insane. Because they're taking away human error. Efficiency. It's achieved through the use of computers and computer technology. Now, some of you might argue that you move slower using the computers, and that is definitely doesn't make things feel efficient. But in terms of data, in terms of information exchange, it really is faster. And also, you know, your place hasn't done a good role in training you properly if it's slowing you down, because eventually you should be able, it should be faster than the paper charting that you're using if you're using it correctly. Easier retrieval of data associated with a particular process, and data sharing is improved between disciplines. And I'm just going to tell you, I'm really happy I don't have to share anyone's chart anymore. There was nothing worse than being like, where is my chart? I have to document. All right, so quality improvement allows for auditing to assure consistent standard of care, measurement of performance against standards of practice to identify systems issues and opportunities for improvement. Benefits of IT in healthcare. Decision support, cues and information built into the system to assist the clinician in making care decisions. Nursing informatic job titles. There's clinical analyst, informatic nurse specialist, consultant, identified as other. What about director of clinical informatics? That'd be a great job. So what can I do for you? Data management. So workload statistics, performance monitoring, performance improvement projects, and regulatory compliance, which you might think boring, but it actually can get really interesting, especially if you're involved in the project part of it. Project management, new applications. The job isn't over when the software is implemented. So you want to monitor the usage, the end users, oversights, and training and education. So new employees, student nurses, updates, annual education and competency, and ongoing reminders. And you can be a national voice. So informatics attitudes. Appreciate the necessity for all health professionals to seek lifelong continuous learning of information technology. Information technology is here to stay. It's not going anywhere. And I'm sure all of you don't feel this way. But I'm sure you work with someone who literally every day, I don't care if it's doctor or nurse or whatever, about informatics and technology. Well, guess what? We ain't cutting down any more trees if we have to. So we have to, as informaticists or those who are proponents or supportive to informaticists, we need to change the attitudes of those around it, right? We value technology that supports clinician decision making, any error prevention, and care coordination. You don't have to be obsessed with your EMR or your informatics system, but understanding its value is important. It does protect confidentiality a lot better. And then you have to value the nurse's involvement in the design, selection, and implementation of information. We know what goes in and out of a hospital, what it takes for a doctor to put in an order or advanced provider to put in an order, what it takes in the OR to document. You know who documents the most? The nurses. And so a nurse's involvement in designing something should be valued overall.